Hi guys, welcome back to Codemaster Coach, your medical coding tutor. We're continuing our studies of the 2019 ICD-10-CM coding guidelines, and we are down to 1B19. 1B19, those of you that are following along with me. If not, let's pull out our code books and let's look at this guideline. Let me show it to you first, okay? Then we'll further discuss. All right, this guideline says, coding for healthcare encounters in hurricane aftermath. And you guys know as well as I do, we've been seeing quite a few hurricanes. So it doesn't surprise me that this guideline is in bold print, which means it's new to 2019. 19A says use of external cause of morbidity codes. And remember, external cause has its own entry, tabular list and alphabetic list behind your alphabetic list to disease and injuries. And it's 1A says, 19A says, an external cause of morbidity code should be assigned to identify the cause of the injuries incurred as a result of the hurricane. The use of external cause of morbidity codes is supplemental to the application of ICD-10-CM codes. External cause of morbidity codes are never to be recorded as a principal diagnosis or first listed. The appropriate injury code should be sequenced before any external cause codes. The external cause of morbidity codes capture how the injury or health condition happened. So that'd be the cause. The intent, whether it's intentional or unintentional. The place where the event occurred. The activity of the patient at the time of the event, and the person's status, such as civilian or military. They should be assigned for encounters to treat hurricane victims' medical conditions when no injury, adverse effect, or poisoning is involved. That correction, they said they should not be assigned for encounters to treat hurricane victims' medical conditions when no injury, adverse effect, or poisoning is involved. External cause of morbidity codes should be assigned for each encounter for care and treatment of the injury. External cause of morbidity codes may be assigned in all healthcare settings for the purpose of capturing complete and accurate ICD-10-CM data in the aftermath of the hurricane. A healthcare setting should be considered as any location where medical care is provided by licensed healthcare professionals. Okay, guys? So, what exactly are we stating here? We're just saying if, for example, a hurricane did occur and you're having to code the injuries to your patients and it's a result of the hurricane, then always go to your external cause injury index and identify the external cause to this. What there is for statistical purposes is what I keep in mind. Our external cause coding helps us to track injuries, accidents, equipment usage that has problems. So in this case, the after effects of the hurricane. And it's telling you always code how the injury occurred. And what it's asking for when it says how is, did the patient trip and fall? Were they, fall down steps? Give the how the injury occurred. Also the intent. We have some injuries that are self-inflicted, suicide attempts, etc. Or unintentional. It was a complete accident and we need to identify those. The place where it occurred, at school, at home, on the job, in a restaurant, in a store. The activity of the patient at the time, playing basketball, baseball, fishing, dancing, etc. And then the status. Was this patient a civilian or was it during military active duty? So external cause codes play a very important role in identifying how injuries occur or giving us that meat of how an injury occurred. Time, place, where, etc. The external cause injury index identifies all of that for us. So as coders. Now, first, we always code the ICD-10 and CPT codes for the diagnoses and procedures, and then we use the additional external cause codes. Okay, guys? Any questions on that? Just let me know. Again, this external cause injury index is supplemental. Your priority codes are your diagnoses and your procedure codes. Also, just want to let you know, I did upload a quick little video on Medical Coder Life. I hadn't been active on my second channel. I kind of left it alone because I was so busy with Codemaster Coach. But when I think of things that apply to coding that I want to share with you, like equipment that companies send to you, and in my scheduled hours, and the advantages or disadvantages of working from home, I just uploaded a quick 5-minute video on my other channel, Medical Coder Life. All one word, Medical Coder Life is my second channel. I just uploaded a quick little video over there this morning as I was thinking about equipment and what all companies tend to send you when you work from home. Okay, guys, tomorrow, yes, tomorrow, I'm going to upload an additional video as we continue these ICD-10-CM guidelines, because not only do we identify the external cause, but I want to talk about sequencing of the external cause of morbidity codes tomorrow. Okay, guys? Thanks. I'll see you in the next one.